Okay, welcome back to today's webinar on BIOFLEX Personal Therapy System, talking a bit about safety precautions and cleaning and basic operation and how it works in general. It looks like many of you or most of you actually have the system, so which is kind of what it was intended for. I try and do these webinars once a month, specifically for the BIOFLEX Personal Therapy System. Usually it's on a specific condition, that kind of thing. But today it's more because I do get inquiries about taking care of it and safety questions, that kind of thing. So I thought it would be good just to discuss that as well too. Those of you who haven't joined in before, my name is Dr. David Kunashko. I'm a chiropractor. I'm also the medical director at BIOFLEX as well. So I tend to do these webinars fairly often, also for professional equipment as well, which we also manufacture and sell to healthcare professionals as well. So again, thanks very much for joining me in today. If you have any questions as I go along, feel free to ask those questions. You can type them into the Q&A chat box. That's the easiest way for me to actually pick those up, and I'll try to do my best to answer those at the end of today's session. So I'm going to again just review the systems, what they're about, and basic operation of them, and then I'll get into some of the safety aspects of owning a light therapy device, a little bit about maintaining and cleaning them, their basic operation. I think I'll even chat a little bit about, again, just reviewing how it's working inside your body and some of the aspects to that. And then there'll be time for a Q&A. And also I have some breaking news. You may or may not be interested, it's hard to say, but every year we do a masterclass, and I was trying to confirm a keynote speaker. And literally I was just speaking to this doctor just before I got online here. So I have an announcement with respect to a keynote speaker at our masterclass coming up on June the 11th. And he's a world-renowned author and psychiatrist. So I'll announce him at the end of today's session as well, if you're interested. All right, so let's get into it. We do manufacture, excuse me, and sell. No, I have a little frog in my throat. So two types of light personal systems, the P120, which just means it has 120 diodes of light, and a P180, which is a larger surface area, a little bit greater energy density, and 180 light diodes, and a controller, of course. Now, these lights, they're a type of LED, a light emitting diode. Now, so they're not laser diodes, and we couldn't make a device like this for home use in essence, because using high-powered lasers are quite dangerous and usually just used by healthcare professionals. But what we can do is use very similar type of technology and energy densities with just a lot of specially made LEDs. So these LEDs emit two different wavelengths out of the same diode, which is quite unique, and they're packed very closely together. So that's basically what you're seeing on this particular diagram. Really, the differences between the two, they're both effective, obviously. One is larger in surface area, slightly greater energy density, you might say, as well. So it really depends perhaps on your body size, or maybe the areas that you're treating. If you're treating just small areas, maybe just your hands or certain smaller areas, or you're a smaller individual, the P120 might be a better fit. But if you are treating larger body areas, like the shoulder, the hip, or the back, those kinds of things, then the P180 might be a better fit. So that's really the main differences between the two. The controller, as you know, has a lot of different anatomical regions. And in general, you're going to choose the region that makes sense for what you're trying to treat. Occasionally, I do get emails from someone that wants to treat something that's not sort of listed there, or is maybe not necessarily what the equipment was designed for. And I take those on case-by-case basis. Obviously, it's designed for musculoskeletal types of symptoms, related to arthritis or injuries, that kind of thing. I mean, certainly can even work on things like compressed nerves and so forth. So that's really the main indication, but it doesn't mean that it may not work for other things. But again, that's something that can always discuss on an individual basis. So when you look at the controller, of course, there's a power to turn it on and off. That's the far left lower button. And then to start or to pause the treatment, there's a button if you need to stop the treatment entirely. And then there's a stage button, which I'll talk a little bit more in depth, because I think sometimes people get a little bit confused about these stages, and I do want to explain that again. So it's important when we're talking about safety is that this type of technique is called photobiomodulation. I know everyone thinks about laser therapy or cold laser therapy. There's different terms that you may be familiar with, but the actual proper research-oriented way to describe this is the use of photons of light. So that's the photon part. And it modulates or changes biological functions or how they function inside cells. So the term now is photobiomodulation. And it uses two different types of wavelengths of light, specifically red. And I think everyone's familiar with some health benefits of red. It's kind of all over the place when you go on the internet. And also uses near infrared. So these wavelengths are around 660 nanometers, give or take, and 840 nanometers in the spectral regions. So these wavelengths do not pose a risk like the more powerful and energetic ionizing wavelengths associated with, say, ultraviolet or X-rays. So the wavelength itself is farther apart with less energy. So in other words, it can't, create damage in your DNA, for example, and trigger cancer like excessive exposure to ultraviolet or to X-rays. So it is quite safe with respect to that. But it is still a form of energy, right? So it's a form of photonic energy, and this will interact with your body or even things on the surface of your body. And because of that, we need to discuss some of the safety aspects of using this device on your tissues. It's important to also understand that there's been decades of published peer-reviewed research clinical trials. So these are like placebo, double-blinded or triple-blinded research control trials. And the consensus is there really have been no reported side effects with this type of therapy. So we do know it's very safe. But that being said, there's still things that we need to discuss about the safety aspects of it. So understanding the wavelengths and electromagnetic radiation, you should have a basic understanding that when we're dealing with ionizing radiation, like ultraviolet X-rays or gamma rays, these are the types of radiation can lead to cancer or to cause an environment where cancer may start. And that's because of mutations that can be caused by this high energy. But as you shift to longer wavelengths and into you get to the visible spectrum and infrared and farther, these wavelengths are much longer and they're considered non-ionizing. So again, we use red and near infrared. And so these wavelengths are considered non-ionizing and therefore not mutagenic. So when using the equipment around your face, now you may do this for different reasons. It's not uncommon to treat the temporomandibular joint, your jaw for pain. Sometimes people will treat their forehead for headaches. So there's reasons you may want to treat around your face. And you can do that, and it's important to understand, remember, this is non-coherent light, so it's not like a laser light coming into your eye. So it's not going to pose necessarily a risk to your eyes, but it can still be quite bright or even irritating to the eyes. So we do suggest that you use the safety goggles that you get with the system if you're treating around that area, and just to avoid irritation of the eyes, right? So it's similar to any really bright light. This is the red I'm talking about. Infrared is invisible. And I do see there's a question. Again, I'll definitely try. I'll get to those questions at the end of the webinar, if that's okay. I guess you don't have a choice, right? So the other thing too is that if you have a history of seizure disorder, flashing light is never a good thing, right? You know, it could possibly trigger an event or what have you. In general, this has to do with flashing fairly low frequencies of light that are visible. Now, red light's visible, but the frequencies that we use for the red light at its lowest is 50 hertz, which is usually a continuous pulse, it looks like, to the naked eye. But even so, I would still exercise caution if you do have a history of that, to avoid using the system around your face or your eyes, even though it's remote that it would cause any difficulties or problems. But any flashing light, regardless of probably even at that frequency, should probably be avoided. And again, I always preface this by saying you can always have a chat with your family doctor or physician about that as well too. One of the concerns about using any kind of energy device while pregnant is that this energy can have possibly an effect on the growing fetus. Now, we don't have any reason to necessarily, or proof or research to suggest that that's the case, but in the realm of energy devices, therapeutic devices, it's always considered a contraindication, meaning you shouldn't apply it over the growing fetus. And that's similar for light therapy as well. So you want to avoid treating in and around that area if you are pregnant, just to avoid any potential issues there. Again, not necessarily based on research or science. It's just a given that you don't want to, for obvious reasons, put any energy near a growing fetus. One thing that I do get asked about sometimes is photosensitive medication. Now, these are the medications you might be familiar with when you look at the warning label on the pill bottle, and often says, you know, avoid excessive exposure to sunlight. Oftentimes it's ultraviolet light that interacts with a medication, and it can cause a rash or can cause some other systemic issues. Now, that being said, the wavelengths that we use for our equipment is not ultraviolet. So it's very unlikely that it will interact with a photosensitive medication. These are usually antibiotics, but even some natural remedies like St. John's wort, for example, is photosensitive. So I would suggest there is that you ease into treatment, just try a little area, see if there's a problem or whatever. It's highly unlikely that anything will happen. And the advice that I've seen and the research that I've seen is that it doesn't cause any issues, but I always still like to be on the safe side. And you can talk to your physician or just do a small test area, but it should not pose a problem. Okay, so photobiomodulation does a lot. What it doesn't do is stop bleeding. So what I'm not going to recommend is that if you have a laceration or a cut and you think, oh, well, maybe I'll throw on my device to try and make it stop bleeding. That's not a wise idea, because it actually can cause some vasodilation with blood vessels, which is good when you're trying to improve circulation, but maybe not so good when you're bleeding. So take care of bleeding tissues as you would normally with bandages or seeking professional care. And then as it's starting to heal and you start to get a blood clot and all the rest of it, then this actually might be beneficial to healing that area up. One thing that does come up a lot is cancer. And I talked about that a little bit earlier. There's really no concrete evidence that photobiomodulation will make cancer worse. Certainly won't cause cancer. But much like pregnancy is, because we don't know a lot about it, the advice is still that we don't want to apply a form of energy over an area of cancer. And that's directly over an area of cancer. So let's say you have skin cancer. I'm going to say don't apply this over the area of skin cancer. Let's say you have another form of cancer that's isolated, a tumor or something, avoid treating over that area. You can treat other areas of your body away from that cancer. It's not going to have an effect on that cancer, but to be on the safe side, I'm going to suggest that you don't actually treat directly over that area. And that's considered a very common contraindication for a lot of therapies for obvious reasons. One shouldn't apply this directly over the thyroid gland. There's a bit of research, actually some research of note of late, that this may not be as much of an issue as we thought, but until we get verification of that, light therapy may have an impact on the thyroid function by increasing its activity, most likely temporarily. But we still say and advise not to apply the pad directly over your Adam's apple where your thyroid gland is. Now, remember, our equipment is designed for adults. I sometimes get asked questions, well, can I use it on my infant or my baby, that kind of thing. I'll be clear on this, is that we're approved for using this device on adults, that there's no research. I have nothing to base on suggesting to use it for young children or infants. Maybe a little bit different. It's when it's a child of a little bit greater age, or certainly a teenager. In general, it's still probably considered safe. I would recommend that you, first of all, again, clear it with the family doctor. But for adolescents, younger teenagers, usually we use a little bit lower dosaging, and that's really just because they don't need as much energy. Not that it's going to cause a problem with them, but I'm going to suggest that you certainly don't use it to treat young children or infants, because that's not what it's designed for. This comes up quite a bit too. People might have had surgery in their ankle or their back, and they have screws or rods or surgical implants that are metal, and they're concerned that it might cause a problem. So the light that's used in this equipment is not heating. It may in fact feel warm, but that's more because of the electrical current that's passing through the actual pad itself, not so much the lights emitting heat. They do emit a little bit of heat, but it's very minimal. So that being said, this light isn't powerful enough to actually heat up these types of implants. So it is safe to use over those areas. Another thing I'm going to recommend is that make sure the area that you're treating when you're applying the pad is clean. By that, I mean clean of oils or creams or medications that you may apply. Some of these medications might interact with light. It's hard to say. They could cause a rash. I've seen a few interesting things. So I'm going to suggest that if you're going to use the equipment, don't apply anything before you go to use it. Okay. And if you need to wipe off with soap and water gently, you can do that before applying the treatment as well. So again, because these things do generate a little bit of heat, more so with the electrical current driving the LEDs, I'm going to suggest that you don't cover the pad with clothing or pillows or a blanket, or maybe your cat's curled up on it, which would make a good TikTok video, but probably not a good idea because you're not letting that heat escape or dissipate. You'll notice, in fact, there's grooves on the surface of the pad. That's a heat sink to allow some of that extra energy or light kind of come off the equipment to cool down. So you don't want the device to heat up, because you're going to, not necessarily cause a burn, but the equipment itself can fail if it gets too hot, and certainly you don't want it. The heat is not something that we want to produce in the tissue when you're using photobiomodulation. So also, with that being said, you'll want to let it cool down a little bit between uses. So let's say you're treating your back and you've had it 3 or 4 different areas of your back, and now you want to treat your knee. Let it cool down a little bit. It might feel warm to touch. So just let it aerate, maybe 10, 15 minutes, all you need to do. And then you can start to use it again. What I do not recommend is using it back to back to back to back for hours on end, because then you might actually start to feel it get quite warm. And it's just not good for the overall health of the equipment as well. Avoid using it in wet conditions. Don't take it in the shower for obvious reasons. It's not waterproof. Okay, so I know it seems silly, but I'm telling you because it's happened. Don't use it while operating a vehicle or machinery or driving or flying your airplane for obvious reasons. Try to avoid excessive pressure or twisting motions of the array. It's designed to bend and curve. What it's not designed to do is bend, at a complete 180-degree angle and be squished all the time, because that just puts pressure on the internal wires in the circuitry, and that will just fatigue those the electrical components quicker, and therefore may need to be replaced sooner than you would anticipate. Same thing for the cables, or the power cables or the wraps. Just avoid excessive bending and twisting of those as well. Try not to modify or open up the system. Maybe there's an issue with it and you thought, well, you know what? I'm just going to open it up and see what's going on in there. Not a wise move. Personal experience is with an iPhone, never works out very well. I've tried that a few times and ends up not going so well. Do not use a system over the eyes. Funny thing is, I had an inquiry today about treating blepharitis, which is an infection of the eyelid. There's some inflammation. Okay, it's an infection. It's over the eye, not indicated. Okay, so don't apply the array over the eye. So if your eyes are sensitive to light, and sometimes people are, you're treating your shoulder, your arm, and you can see the light, perhaps you can throw the glasses on just to avoid any slight irritation of the eyes as well. And let's say you're a passenger in a Tesla, and you can do everything in Tesla. You can play a video game or do whatever. I would say don't use the system in a car as a passenger, because the bright light, again, can be quite distracting, especially the red light. So I know it seems like common sense, but you know what they say about common sense, right? Don't leave the device unattended while in operational mode. Let's say, oh, you know what, you just want to go grab something, and then next thing you know, you forgot about it, and then next thing you know, your cat's chewing on it or something, right? Or whatever the case may be, right? So more on that is keep it out of the reach of children, or perhaps people that may not be able to operate it properly. Okay, let's talk a bit about maintaining and cleaning the equipment. In general, I'm going to recommend an alcohol wipe, or maybe a 70% dilution of alcohol on a non-abrasive cloth or paper towel. You don't need to soak it, just make it damp with the alcohol and clean it off, probably in between uses, or certainly if it's just you're using it on yourself, maybe after every 2 or 3 sessions, that's fine. But given COVID and everything else, it's always good just to make sure that it's kept fairly, not necessarily aseptic, but at least relatively clean, right? You can also use a mild disinfection as well. I wouldn't use like Lysol, those kinds of things. They tend to have some oils and perfumes and things in there that may react with the silicone, so I would avoid doing that. Obviously, don't immerse the array in water of any sort. Again, it's not waterproof necessarily. It's not designed for that. There are straps a strap that comes with the system. You can throw that in your washing machine or hand wash that as well too. The system is electronic, right? So, and lights, so you never want to store it in excessive conditions, whether it's cold or heat. So don't throw it outside in -30-degree weather and forget about it. Again, avoid excessive, I think there's a repeat, avoid excessive bending of the power and cables. I always like to talk a little bit about how this works, because some of you may not be familiar with it or just know a little bit about it, but as a little review, I do like to mention how this light is interacting with the cells. And it does this in a unique way, and it does it in a way that affects cells that are inflamed or tissues that are inflamed or under metabolic stress. And by that, I mean, these cells have some kind of problem, right? It could be arthritis, it could be an injury, it could be some kind of inflammation. But the cells are reacting to chemicals released by white blood cells that are causing this inflammation. And these chemicals will have an effect on the ability of the cell to function. One of these chemicals is nitric oxide. Nitric oxide is a really interesting compound, and it can cause vasodilation of blood vessels. And it has a lot of positive effect in the body. But when the levels get too high because of inflammation, it actually shuts down the ability to produce energy in the form of adenosine triphosphate, or ATP, from mitochondria, which are the powerhouses of the cell. And so with these high levels of nitric oxide cause the cell to undergo what's called metabolic stress. And sometimes the cells will go quiet or quiescent, and they can't repair themselves, they can't function normally, and sometimes they'll even die. So prolonged inflammation is something we want to try and avoid. What the light seems to do, or we kind of know it does, is that it has enough energy to actually inhibit nitric oxide from binding to specific enzymes in mitochondria that causes slowdown. So when you're constantly bombarding these cells in the mitochondria, it actually frees up this nitric oxide, which actually can diffuse outside the cell or breaks apart into nitrogen and oxygen, allowing oxygen to bind where nitric oxide is binding. And that actually causes now the cellular machinery to start to produce more ATP, more energy for the cell. Once the cell gets revived and starts to function more normally, it can replicate, repair, regenerate, and you can start to see some healing going on. So that's kind of how it's working. I'm not going to describe everything else going on in there, but that's the sort of the key aspect of how this works. Now it has different effects on different body areas, everything from increasing circulation to help promoting collagen formation and scar tissue modulation. It can help muscles recover and repair from strains. It can reduce inflammation and edema, and even help nerves and cartilage and bone heal as well to some degree. So the wavelengths that we use, red and infrared. Now, red tends to be absorbed a lot by melanin, which is in your skin. That's what gives you color. That's also absorbed a lot by, to some degree, hemoglobin and blood. So red light doesn't go very deep. It's really great for treating superficial blood and superficial structures and tissues, but not so great for getting deep down into the muscles and deeper lying tissues. For that, we use the near infrared. That has more of an ability to go deeper because it's not as absorbed by melanin or hemoglobin, so it's more transparent. And that allows this light to permeate and get into the joints and the muscles and deeper aspects of the body. And remember, I said it affects mitochondria. You know, what's really fascinating is that the number of mitochondria per cell varies with the function of the cell. So a red blood cell has no mitochondria because they're an offshoot of a cell. They're actually not a regular type of cell in your body. But if you look at other cells, like a skin cell, a mucus cell, a muscle cell, they all have a varying average number of mitochondria, meaning that the higher the number of mitochondria, the more energy that cell consumes and uses, right? And so in nerve cells can have up to 2 million mitochondria. The reason why this is so important is that the more mitochondria in a cell, the more it will react to light. So sometimes we need less energy to help with cells that have lots of mitochondria compared to some cells that have fewer number of mitochondria. And some of this work has been done by researchers, and a lot of the work is done clinically by Dr. Fred Kahn, and over the years developed some strategies in delivering the light to take this into account. And really how this works is pulsing the light. So we tend to have this light not just coming out in a continuous stream of light, but we turn it on and off. And oftentimes that's maybe 100 cycles per second or 500 cycles per second or even 1,000 or greater. These frequencies are built into the protocols in the different levels of the equipment. And what it allows the cell to do is use the energy in small packets of energy in between a dark phase where there's no light. And this makes it more efficient for the cell to utilize the energy. So the system itself has these 4 anatomical areas, and you would just choose the area that makes the most amount of sense for the condition that you're treating. Generally speaking, larger areas might have slightly longer treatment times or more placements because there's more tissue in there. Some areas as well, even the elbow and the wrist, Dr. Kahn found that because they're quite bony, sometimes the light's hard to get through, that kind of thing, or a bit more sensitive, they may require, or sorry, not as sensitive to light, they may require a little bit longer treatment times as well. So one thing I need for everyone to understand is that light that's coming out of the equipment is measured in joules, which is power times time. So that's watts times a second. And so, for example, in the P180, there's roughly 1,165 milliwatts. That's 1.165 watts. And if it's on, let's say, for 6 minutes, that's about 420 joules of energy over that time frame, right? But if we measure it over per centimeter squared over the entire surface area, then that's about 2.6 joules per centimeter squared. That's the therapeutic dose that you'd be receiving. The stages in the equipment are designed to reflect these protocols. So in general, from 1 through 4, you'll have increasing dosaging and increasing frequency or pulses. Level 1 is where we tend to recommend you start with, and it has the lowest dosaging and frequency typically. So always start with 1, give it some time. I usually say at least 4, 5, 6, 7, 8 sessions before you decide to move up to the next stage. So if you feel your symptoms aren't necessarily making a huge improvement, that's when you can navigate up a little bit, but give it time. Remember, we're trying to heal. We're not trying to block pain per se. Although you might feel pain relief quickly, it's not correlated to healing. So you do need time for that to occur. So all protocols will have red light first, followed by the infrared light. In part, that's important because the red light saturates a lot of the photoacceptors and superficial layers, allowing infrared light to even penetrate deeper. So in stage 1, typically, but not always, red light will be coming out in a continuous wave. And this provides a lot of anti-inflammatory effect on the circulating white blood cells and stem cells and platelets going through your blood. And the infrared light in the stage 1 is usually pulsed fairly lowly, between 20 and 50 hertz or pulses per second. This tends to be quite effective for most patients. Duty cycle is something where it's like a dimmer switch. The higher the duty cycle, the higher amount of light coming out. So it's like a dimmer, low duty cycle, low dim, so low light, high duty cycle where you turn the dimmer switch all the way up, brighter light or more energy. So this duty cycle also ranges in stage 1 between 50 to 60% of the total amount of power that we can generate. And then as you get into stage 2, you start to see more pulsing, especially with the red light. You'll start to see slightly increased duty cycles and therefore more dosaging and more stimulation. So stage 2 is going to help you overcome where you may be feeling a plateau or perhaps not feeling as much benefit as you would want at a certain time frame. Then when we get to stage 3, similarly, you're going to see even more pulsing of red light with higher frequencies and higher duty cycles to maximize the energy in the device. And now the infrared at stage 3 or level 3 is definitely a lot higher. Again, you're going to be using these higher levels, stage 3, at a point where you've given stage 2 a fairly lengthy time to work, not just once or twice. We're going to suggest several weeks, if not a month, at stage 2 before stage 3. Don't be impatient. If you have arthritis, it's taken your whole life to get arthritis. You're not going to make it disappear or have it greatly impacted in a short period of time. Well, some people respond much faster than others. On average, it does take a bit of time. By the time you get to stage 4, frequencies are much, much higher, sometimes thousands of pulses per second, and usually a pretty high duty cycle. So stage 4, level 4, is going to have your highest amount of stimulation. Remember, it doesn't necessarily correlate that this is the best level. Everyone's different, and some people respond much better to level 1 than level 4, and vice versa. So again, always allow enough treatments to ascertain if that stage is helping, right? Be patient, allow time for the tissues to heal and for the inflammation to slowly resolve. If you stop treating an area for a significant period of time and then go back to treat it, start with level 1 again. Okay, let's say you're treating your knee arthritis, is feeling pretty good, you lay off for a month, then start back with level 1. Preferably, if you're treating arthritis, you should be treating it on an ongoing maintenance basis, at least once or twice a week, and probably at level 1 or level 2. Sometimes taking a break from treatment is also beneficial, a week, 2 weeks, and then reinitiate starting at level 1. Cells sometimes can accommodate to energy and to therapies. So you're kind of resetting the cells a little bit and then starting again. It might be very beneficial as well. Wonderful. Okay, so I know we're out of time, and we'll get to your questions. Do you have a few upcoming events? My next webinar is on chondromalacia patella, and that's coming up February 24th. I'm doing a new series of events on introduction to photobiomodulation, a lot more in detail and more in depth. It's a 3-hour event, and that's called Light Up Your Practice, geared more towards practitioners, like clinicians, but it's open to anyone. If you want to join in and register, you can just go to our website for that. And I also have an advanced certification training course, again, more designed for clinicians, but anyone's welcome as well. Next one is April the 9th on nerve healing with laser therapy. And my announcement mentioned earlier, gave a bit of a tease there, was Dr. Norman Deutsch, who maybe some of you have heard of, has written 2 books, New York Times bestsellers on the concept of neuroplasticity and healing techniques, including light therapy, has agreed to be a keynote speaker at our masterclass. That's on June the 11th. The details will be posted on our website pretty soon. Norman has had a relationship with our BIOFLEX and especially Dr. Fred Kahn. So he'll be talking a little bit about that, concepts of neuroplasticity. It's going to be quite interesting. It will be a sort of an informal interview and him just chatting about his work in this field over the last decade or so. Well, longer than that actually, but certainly with these books the last decade or so. And even if you're not necessarily into neuroplasticity, I think eventually as we all get older, you'll want to think about that, because our brains definitely do erode with time, and there's lots of techniques and ways of helping an individual. So it will be fascinating to listen to him and have him chat a bit about what his work as well. So if you're interested in that, we'll be setting up the portal to sign up for that. It will be online, live via Zoom. I just can't do it in person yet. I just still a little queasy about COVID is opening up to to in person yet. And there's a chance, but I think it's just going to be online, just to let you know.